Is going to come on. I have sent her the invite. Chalo, let's start. It is 4 o'clock. ना इतना सारा हो गया
Yes.
ऐसा कैसा कितना ऐसा कितना है 70
69.
होता हो ना
Yeah.
you didn't check.
Check 100% was there.
That's strange. Okay, it's a short one, it's not a very long one. All right, guys, today's lecture is prenatal screening. Okay, you got your PPT with you, and this is a little bit of an overlap of the first lecture that we did 2 weeks back. All right, so usually when they're asking for a prenatal panel, these are the tests that are asked today, right? CBC, ABURX, blood sugar, routine urine, VDRL, TSH, so besides the sonographies, etc. And now doctors insist on first trimester screens, previously done on women over the age of 35. Tests are free HCG and Papa A, and so on. The second trimester, they add on triple markers and quadruple markers. Can you reduce this? This keeps coming in the way. Yeah, okay. All right, let's go to slide 2. Okay, like I told you, it's a little bit of a overlap. So the history, 1887 through 1970, now known as Down syndrome. And this Down syndrome has a very interesting title topic. So Down syndrome is named after John Langdon Down, the British doctor who first described the condition in 1887. It wasn't until 1959, however, that an extra chromosome was identified as the cause, yes? At the site of 21. So Down syndrome is a genetic condition in which a person has 47 chromosomes instead of 46 and affects 1 in 800 babies. Causes, incidence and risk factors. In most cases, Down syndrome occurs when there is an extra copy of chromosome 21. This form of Down syndrome is called trisomy 21. Chromosome 21, C21, trisomy 21. There are 3 on that site. The extra chromosome causes problems with the way the body and the brain develops. Down syndrome is the most common single cause of human birth defects. And there is so much available today in the US and over here. And I can tell you that these kids are the sweetest I have come across, because we at Sophia with the Sadhana school have quite a few of the kids with Downs, of course now they are with other problems and so on. So the Indian scenario data from a paper by Dr. Jay Sheth, 2007, triple marker studies in mid-trimester of pregnancy and risk of chromosomal abnormality. That's the title of this paper. Every year about 18,000 babies are born in India with trisomy 21. That's quite large amount. With the advent of widely used and documented serum markers during mid-trimester, every pregnancy can be monitored for the most common aneuploidy like trisomy 21, trisomy 13, trisomy 18. 13 and 18 are quite pathetic. Current consensus in India shows that 1768 babies are born every hour. Considering the incidence of 1 in 920, 1 is to 920 Down syndrome child, every hour 2 new DS babies are born with an annual incidence of 18,000. This can be prevented by assaying serum markers in trimester 1 and 2, fetal ultrasound markers and abnormalities. So now think what we did in the first lecture also. And really when you have that as a result, it's very sad. So other trisomies, you've got the Edwards syndrome, trisomy 18, 1 is to 3,000 births, also known as the Patau syndrome, and effects are 1 in 500 births. And you can see the pictures. Okay. Then you got the Klinefelter's syndrome. Maybe you do know that XXY. Exit features, male internal organs are incomplete. And this is the XXY son. Okay. So Turner syndrome, XO, incomplete sex organs due to incomplete X. And you know the male is XY. So if the X is incomplete, the person is going to have problems. And you can see it here in the diagram. And I think, no, go back again. You can see at the bottom, you can see what we're showing. This X is incomplete, and that will give rise to Klinefelter's syndrome. Okay. Symptoms of Down syndrome. Symptoms vary from person to person and can range from mild to severe. However, children with Down syndrome have a widely recognized appearance. The head may be smaller than normal and abnormally shaped. For example, the head may be round with a flat area at the back. The inner corner of the eyes may be rounded instead of pointed. Common physical signs include that. We'll take a look at it. And you can make out, I'm sure you've seen a lot of Down syndrome children. And some of them really have bad defects, but some of them are very intelligent. And they can be taught skills. They are now known to work in restaurants. They are now known to work in shops, and they should be encouraged to do so. It depends on the parents. So, decreased muscle tone at birth, excess skin at the nape of the neck, and your sonography will tell you that, right? Flattened nose, separate joints between the bones of the skull, sutures, single crease in the palm of the hand, that is another one, small ears, small mouth, upward slanting eyes, white short hands with short fingers, white spots on the colored part of the eye, the brush-filled spot. These are the most common features of a mongoloid child, and you can take a look at the picture on the right hand side. But like I told you, they can be very, very, very intelligent also. We just lost a dear friend's child at 62 years old in England, and this chap, Porush, would go everywhere, help the mother and the father in the house, and he even worked in a shop. And suddenly my cousin tells me that he just dropped one day. That was last week, so there was a funeral was held last week. Okay. So risk increases with age of the mother. So anybody previously the age of 35 and above had to have these marker studies done. Okay. Now in America, because insurance pays, every woman who's pregnant has to go through the dual marker and triple marker, and it's paid for by the insurance. Okay. So when should a Down case be suspected? Experts recommend genetic counseling for persons with a family history of Down syndrome who wish to have a baby. So there is history both sides, and the couple is monitored, the couple is counseled. And let me tell you, at Sophia, I have seen 3 kids, 3 children, 3 siblings, all with Down syndrome. And I remember asking these parents long time back, because when they came to pick up the children in the evening, so they said that, oh, we thought we'd take a try, one child will be normal, one child will be normal. And all 3 turned out to be Down syndrome, and very, very sweet and very intelligent, luckily for them. All 1 boy and 2 girls. Woman's risk of having child with Down syndrome increases as she gets older. The risk is significantly higher among the age group of 35 and older. Couples who have already had a baby with Down syndrome have an increased risk of having another baby with the condition. Tests such as nuchal transparency, ultrasound, amniocentesis, or chorionic villus sampling can be done on fetus during the first few months of pregnancy to check for Down syndrome. The American College of OB/GYN recommends offering Down syndrome screening tests to all pregnant women regardless of age. And this is very important because I remember when I was a student in America, my biochemist gave me a book. We didn't know much about it then, but says, "Come, let's play God." I had the book, I bought the book, I had it in the lab, and somebody flicked it. And here it was like, one child Down syndrome, second child Down syndrome. Then what do you do? Because we didn't have tests like this to say, really, this child has one and so much percentage rate of being abnormal. And the little book was written which says, "Come, let's play God." So many parents said, "We'll take a risk. We don't know whether the child is going to be normal or abnormal." And the others said, no, since already 2 of our children are that way, we don't want to take a risk. We'll go ahead and have the abortion. That's the reason the title, "Come, Let's Play God." At that time, we didn't have these marker studies. Now we do. All right. What is the first trimester screen? The first trimester screen is performed between the 11th and 13th week of pregnancy. Because the test is performed so early, it is often used to determine whether a mother should consider undergoing an early first trimester test, such as chorionic villus sampling, CVS, or second trimester amniocentesis. Invasive techniques like CVS, choriocentesis, amniocentesis, though 99% accurate, increases the risk of miscarriage by about 0.3 to 1%. And this is also done if there is any questions asked, because your blood test is external. Now this is actually going into the fetal cells, picking up the amniocentesis or choriocentesis and examining if there's an extra chromosome. So there is a little bit of damage, and miscarriage can occur in spite of the baby being normal. So that is a risk one has to take. Okay. What tests are included here and when should they be done? So the first trimester. In babies who are at an increased risk of chromosomal abnormalities, increased fluid is often found in the nuchal transparency, and your sonography will look into that, behind the neck. Abnormally high free HCG and low PAPA levels are indicative, so keep that in mind. Abnormally high HCG, low PAPA-A. The first trimester screen combines the results of these 3 measurements: nuchal transparency, HCG, and PAPA-A. No nasal bone with maternal age risk factors, and determines an overall risk factor for chromosomal abnormalities. A positive abnormality probability will indicate further testing. All right, so this is in the first trimester, depending on the results. And of course, now you've got machines. You do these tests, you feed everything into the machine, and the machine will give you the probability whether the child is going to be normal or abnormal. Now then you've got the nasal bone, NT, CRL, BPD, biparietal diameter, fluorescent sonography findings. The above 3 are sonography measurements important in the first trimester. NT should be less than 2. CRL, that's your crown risk, your diameter here on the head, around 45 to 65 millimeters in normal fetus. So that is the way they measure crown to rump measurements. All right, interesting. Nasal bone, you can see if nasal bone is present, If no nasal bone is present, then there is a problem. And the sonography will tell the doctor what it could be. All right, next slide. Risk assessment. Comparison of detection rates of different screening methods. Maternal age, very important, 35%. Maternal age and maternal serum biochemistry at 15 to 18 weeks, 50 to 70% you can catch something. Maternal age and fetal nuchal translucency at 11 plus 13 plus 6 weeks, 70 to 80%. Maternal age and fetal NT and maternal serum free HCG beta and Papa A at 11 to 13 weeks, 85 to 90% chances are there to pick it up. Maternal age and fetal NT and fetal nasal bone at 11 to 13 weeks, 90%. Maternal age and fetal NT and NB and maternal serum is free HCG beta and Papa A 11 to 13 weeks. So you can see that the percentage is increasing. HCG human chorionic gonadotropin, A Papa A, and that's the thing. HCG, and Papa A is pregnancy associated plasma protein A. Comparison of the detection rates for a false positive rate of 5%. Different screening methods for trisomy 21 in prenatal screening, that is also looked into. And this is a clip from the London FMF literature. Fetal. What does second trimester screening involve? Quadruple markers. Between 15 and 20 weeks of gestation, the mother may be given the option of having a screen test for Down syndrome and open neural tube defects such as spina bifida. Included in the screening panel are tests for alpha-fetoprotein, human chorionic gonadotropin, unconjugated estriol, and sometimes inhibin A, markers that turns the triple test into a quadruple test. Keep these tests in mind. This blood screening panel provides an opportunity to assess the risk of these conditions occurring without performing the more invasive amniocentesis procedure. In most cases, only those patients whose blood screening results indicate a potential problem need to be referred to the amniocentesis panel. During the second trimester, it is expected the levels of AFP and unconjugated estriol, that's your E3, will increase. AFP and E3 increases, the amount of HCG will decrease, and the amount of inhibin A will stay relatively constant. Keep these things in mind if you can. In pregnancies where the fetus is carrying the chromosomal defect that causes Down syndrome, the results of these triple and quadruple marker tests tend to show decreased levels of AFP and unconjugated estriol and increased levels of HCG and inhibin A. This para is important. I'll read it again, just bring it back. In pregnancies where the fetus is carrying the chromosomal defect that causes Down syndrome, the results of the triple or quadruple marker screens tend to show decreased levels of AFP and unconjugated estriol and increased levels of HCG and inhibin A. A new parameter added in second trimester screen, it is called invasive trophoblastic antigen, IT, something new has been added. IT is a hyperglycosylated form of human chorionic gonadotropin, HCG, and is produced by cytoblasts during embryonic implantation and trophoblast invasion of the uterine wall. Levels tend to increase in Down syndrome affected pregnancies. New tests are needed with higher detection and lower false rates. Hyperglycosylated HCG, also known as an invasive trophoblast antigen or ITA, is a new test. It specifically detects a unique oligosaccharide variant of HCG associated with Down syndrome pregnancies. So this is something new that has been added on. Advantage statistics. Hyperglycosylated HCG is a new base marker for Down syndrome screening in the second trimester of pregnancy. The measurement of hyperglycosylated HCG can fundamentally improve the performance of Down syndrome screening protocols. Keep that in mind. The median hyperglycosylated HCG value was 9.5-fold higher in Down syndrome cases. 9.5 multiplies of the normal karyotype median. The single test detects 80% of Down syndrome cases at a 5% false positive rate. Urine hyperglycosylated HCG was combined with urine beta core fragments, urine breakdown products of serum HCG, free beta unit, serum alpha protein, and maternal age-related risk. This urine serum combination detected 96% of Down syndrome cases at a 5% false positive rate, 94% of cases at a 3% false positive rate, and 75% of cases with 1% false positive rate. So it's a good test to have. These detection rates exceed those of any previously reported combination of biochemical markers. Okay? What are MOMs and where are they used? Multiple of median, so keep that in mind, MOM, is a measure of how far an individual test result deviates from the median. A multiple of mediums, MOM, is a measurement of how far an individual test deviates from the median. MOM is commonly used to report the results of medical screening tests, particularly when the results of the individual tests are highly variable. The median is the score located at the center of the distribution. It has to be. MOMs have to be calculated for each ethnic population as they can differ. MOMs are necessary for software that calculates risk. So people with different type of backgrounds will have different types of MOMs. And your machines automatically take that into consideration when you feed the results in, all right? So this is the SSDW software, which is very, very common, put out by Roche. So SSDW Lab 5 high results, first semester screens. Current version is 5.09, is in use, and I think now there's another one that's come up. Needs special key to operate. It is user-friendly software, easy to use. SSDW software incorporates patient-free HCG beta and Papa A. Incorporates patient's age, weight, LMP, ethnic origin, can incorporate father's details also. Incorporates NT values from sonography results together with CRL, crown rump length, and the nasal bone. MOMs are incorporated in the software, calculates risk of different trisomies, has features to calculate risk in trimester 2 with HCG, alpha fetal values, and U3, estrogen from mother's machine values, and can do quadruple screens also with inhibin A. So it's a very, very versatile machine and software that is promoted, and quite a few, even in India, use it. There are others also, let me keep it in mind, it's not always this, all right? So we talk of Papa A, protein associated with pregnancy, large glycoprotein, molecular weight of 200 kD, biological active as 2.2 heterodimer in combination with NBP, secreted by placental trophoblasts, released directly into the maternal serum, not present in amniotic fluid, detectable at 6 weeks thereabout of pregnancy approximately, Serum concentration increases until term. Regular IGF bioactivity in several systems include the human ovary and cardiovascular system. Decreased levels in affected trisomy 21 pregnancies have been seen, about 50% of normal. MOMs in weeks 8 to 14. Also, in case of intrauterine growth restriction, premature delivery, preeclampsia, and stillbirth. Discriminatory power to be used in the first trimester by the doctors. This is the software. You can see, you can incorporate everything from name, age, birth, the results, father's ethnicity also, and then you will have the risks that are calculated. All right. Free HCG. HCG, you know, that's human chromatography. Glycoprotein hormone 37 kD, secreted by the placental trophoblasts. Biological active HCG consists of non-covalently linked alpha and beta subunit. Release of free HCG beta subunit by elastase activity, approximately 1% of total HCG in serum. Detectable 10 days post-ovulation. Peaks between 8 and 10 weeks. Increased levels in trisomy 21 affected pregnancies, 2 to 2.5 moles. Okay. Assay. This is one of the Roche machines. Papa A, standardized against commercially available Papa A method, which was standardized against IRP 78610. Sandwich assay. Sample volume 50 microliters. Turnaround time 18 minutes. Measuring rate from 4 to 10,000 milliIU per liter. Automatic sample dilution 1 in 10. Specimen is serum, diluent, and this is the Alexis Universal machine. Control MC maternal care. Okay. Then you've got the standardized against IRP NIBS code, that's a code. Sandwich assay, sample volume 10 microliters, turnaround time 18 minutes, measuring range 0.1 to 190 IU, automatic sample dilution 1 in 10, specimen is serum, diluent Alexis Universal, control is PC maternal care. I'm just showing you that these machines are available. Lower detection limits of Papa A is less than 4 milliIU per liter. LDL for free HCG is less than 0.1 milliIU per liter. And this is the Roche assays and software. Main goal on the whole, assays and software offer a high detection rate and low false positives, which is really very, very important. We don't want to give false results, and then there's heartache for the pair, for the couple. You come to the last slide. No, one more. So disadvantage, as it is an open software and one can change a few parameters, units of results, not advisable, but there are reports of the same. Software then becomes instrumental in wrong interpretation of tests, and this is up to the lab which is using it. You're advised not to fiddle around with these results and units and so on. Goal 1, on the whole, our sensitive and specific assays and user-friendly software offers a high detection rate and low false positive. That is wonderful. This helps early diagnosis and tells the physicians in which direction to proceed in trimester 2 and 3. An important direction in a woman's health program. That's what we are all about. Of course, this is all Roche ka PR, and we are known to follow it very, very carefully. Because could know, should know, must know. You can see the 3 little rings on the side. And for the main goal is to have a healthy baby. And you can see this baby is very healthy. And thank you for listening to this presentation. Okay? You've learned something interesting?
Yes, ma'am.
Anybody?
With lots to learn.
Rohina, what do you say? Rohina sleeping?
Yes. No, I'm here.
Yeah.
I was just trying to put on the microphone.
Yes, there's
Yeah,
a lot.
I
There's a
am
lot
here.
to learn because I said this was an overlap of the first lecture that we had, and this is very interesting. This is practically applicable. Parizad, are you
I just
understanding?
want to ask you a question. Yes, ma'am. Thank you. Thank you.
Nazneen, your comments? Nazneen, is she around?
Yes,
I think she's working. Ruzbeh, I would like to ask you about Asperger syndrome. Is that also genetically a defect? I've seen that happening to parents.
Yes,
who are
but
very
listen,
much-
let me read upon it. I am not too very familiar with it, yeah. And it's quite common in America, I think. What do you know about
Yeah,
it?
I don't know why. I know that, okay, it's my cousin,
yes, ma'am.
he's married to his cousin.
Uh,
Three are cousins.
Mm.
But the thing is that their parents are brother and sister. You know? So it's like a cross connection.
mm.
Like the boy's parents and the girl's parents are related. Like brother, sister, and then they are.
A name for Asperger. What is it? Give me the right name.
Asperger. Asperger.
Asperger. Yeah, I've heard of it.
Yes.
I haven't
It
seen.
was on that Shah Rukh Khan movie, My Name is Khan. You know, he had that.
Yes, I think Tom Hanks. Tom Hanks. It was a movie by Tom Hanks.
I guess so, but I think
Yes.
Shah Rukh Khan, My Name is Khan, that actually reflects on Asperger syndrome.
Mm.
He speaks about it. Yeah, I've seen people in America having it. I don't know why. Maybe it's.
I haven't seen it over here. I know that America has it.
Yeah. And there's another one which I don't know the name about, but I will find out and I'll ask you about it.
It leads to autism, right? By significant, I'm reading from difficulty with social interaction and non-verbal communication alongside restricted repetitive patterns of behavior and intense narrow interests. Individuals usually have average to above average intelligence without significant language delays. So
What I know
I
about is they don't like social interaction at all. They don't like crowds, don't
Yes.
like people around them.
Mm.
But they're this boy is very intelligent, and he, of course, in Canada he gets all the. He doesn't go to a special school. He goes to a normal school, and he's outdone himself, like very smart in school. But he doesn't like people. He doesn't mean making friends. So they
see,
always
autistic kids are also like that, ne? Autistic kids are also like that. And now I think we are having more and more at Sadhana school. इतने डाउन सिंड्रोम वाले नहीं हैं लेकिन ऑटिस्टिक kids get that is what sister was telling me some couple of years back.
Right.
So it's there.
Yeah.
And I think especially when there are this consanguineous marriages will promote it further.
True. That's true.
It's like G6PD, but in G6PD the brain is not affected. It is the hemolytic system that goes into a wrong gear.
Right.
And I think I've told you what has happened in my family. It's not directly, it is something married. The lady who married my mama came from there. It came from there. We lost one we saved, and it's doing perfectly okay. But we never knew anything about G6PD till I went to America. And I was embarrassed to death when Dr. Landon told me, because the other son had it. He come down with jaundice again, and he says, Rose, your passi Zoroastrian? I said, yes, sir. He says, they had the G6PD done. And he quoted Dr. Undhiria's paper to me. 11.6%. But what the study I have done is more than 11.6, about 12 points, 12.8 study, 12.8%. And Boris have it. The Boris have G6PD because again there's a cousin marriage, no?
Yeah, I know. I have another question. This is regarding the Down syndrome. One is I have seen 2 or 3 cases like in my community spread across. It's not like one area. The lady was about 25, 28 when she had that baby. It was a Down syndrome baby. And then she had 2 more babies after that, which were normal. So, of course, that precaution, that care, or at that time the test also was not there because that baby is about 70 now. But of course, they have a child who's got Down syndrome. So, does it happen like to have more than one? I mean, maybe 2, but maybe more than that in a family?
I told you there's one. There is one case at Sadhana school. All three.
That's sad.
All three. And I told you that book. What was given to me by my biochemist, which says, "Come, let's play God." I got it here, and somebody flicked it. And we didn't have. In the early 70s, we didn't have these tests in America. And the option was where you have one Down syndrome baby. Do you want to take a risk with the second? Go ahead and abort. Come, let's play God. We're playing God, isn't it?
Yeah, true. Actually, in Kuwait, my daughter, she works with special needs kids. And of course, some of them, they are, they have Down syndrome. But that family has 7 or 8 kids, so they don't mind, they keep having babies and they have a kid. And then that kid, of course, is a special kid. They always call it, an angel from God. That's the name given. So yeah, they don't play God at that time. They want to have more babies.
Now, what sort of special needs did your daughter have?
Oh, they have autism, a lot of autism, ADHD, and of course children with Down syndrome. So they have these. She's also giving exams for these. So yeah, that's why this came into my mind about Asperger. We don't have any cases in Kuwait. So I will look into that. I'm trying to find to do a research on this with her help. Let's see.
It's sad having children who have special needs, but there are schools also over here, and Sadhana School at Sophia is one. You are familiar with it, all you Sophia College girls, and I'll tell you. I think I've told you about my mother. She took over this association from Maharashtra State, and they had about 18 of these kids, and my mother took over as chair, and I was so proud of her. I think how old was she? She was about 70 plus. So she went back and taught herself all about these special needs. She was at Sophia at the Polytech for some time, and then at our school, Jesus Mary had a whole section which they closed down. She was with the nuns for some time, and she learned a lot how to deal with them. And she went, and luckily for her, she got a very nice assistant. They went and they started the programs of embroidery, cooking, etc., etc. So I think Mummy started with 16 or 18 students. When Mummy died, a few years later, she had 35, and there were 10 on the waiting list. They did so well, they had embroidery and they cooked and they did all sorts of things. And the only problem Mom had was, conveyance. Some of the parents were a little diffident and they were having trouble with the BST, and they were all these lower middle class kids. They were not those very fancy kids that Sophia has. Maybe 1 or 2 of them had cars. So she went up to BST and told them, they will have a card. See to it that you don't charge them. And then this gentleman who had old eco, so she told him, why don't you carry a few more on your route? They can pay you a little. And then I think luckily they got a donation of a station wagon, and whoever they could pick up on the way, they could pick up. And the other kids came by BST bus, free pass. They didn't have to pay a single penny.
That's nice.
And it is really wonderful that somebody like her with tremendous patience, and she would tell me, Ruzbeh, you don't come, you have no patience, tremendous patience with these kids. And she got, I think she was operated I think a few months before she died, and we had a whole lot of them up here. They came up in a line to meet her, they bought cards for her, they got flowers for her. And again when she died, few days later, they all wanted to come and see her, but then they picked up. I was told, I said, pick people who would be able to see that, and they picked about 8-10 of these kids who came with the teachers to pay their respects. So that was it. I was very, very touched. I was very, very touched, and I must say that of my mom, tremendous patience. Went back and she learned. She was going to take it over. She went and learned. She was in Sophia for some time. She went to Jesus and Mary and learned how to deal with these kids and what she could start. And with her luck, she got a very good assistant, a young girl who had a BA in psychology, and she had done this. And they started embroidery, they started cooking, they started doing all sorts of things. All sorts of
That's
things.
awesome. That's awesome. Actually, these kids need that kind of, learning. Like, they don't have to study.
But
They have to-
I
there is-
luckily I have told the lady who took over after mummy, luckily she tells me, says, we are carrying on City's legacy, so you don't worry.
Yeah. Lovely.
Anybody else? Nazneen, any problems? Your side of town? Nazneen, unmute. Nazneen? I think she's on. I know she hasn't gone away. Anyway, I think we'll end then. Any other questions? This is routinely done now, guys, so keep it in mind. You have somebody in the family, some friends, that you know what tests are done and when. Okay?
Yes.
So can we